Hello there. As promised, I am going to give you a deep dive into the world of blood sugar. And what I want you to know is that while this is not a super sexy subject to talk about as far as health, weight loss, nutrition goes, is actually the biggest, most important piece of the whole equation. Like I said before, no one talks about it. No one makes this the focal point of their diet or exercise program, but this is the key to health and longer life, and not necessarily just longer, but also a thriving and healthy life where you're not on a bunch of medication later on and feeling like shit all the time. So listen up. So blood sugar, also known, you may have heard the term blood glucose. Glucose in our blood is what gives us energy. So when we eat anything with carbohydrates, could be kale, could be cake, your blood sugar, the sugar in your blood rises. Obviously, it's going to rise a lot less with kale than it is with cake, but it does create a little bit of a blood sugar rise. And more so, the more processed, sugar-filled, processed carb-filled the food is. So when you have sugar in your blood, your body releases insulin, which is a hormone that our pancreas makes to bring the sugar out of the blood and into our cells for energy. Our bodies, so those of you who have been working with me have seen this diagram. Our bodies like to keep our blood sugar between 80 and 120 at all times. This is actually fairly amazing that our bodies can keep this tight range going, but it's pretty cool. Just because my son has type 1 diabetes and his blood sugar goes anywhere from like 40 to 400 within minutes. It's pretty crazy. Oh my gosh. Okay, so insulin is a good hormone, and we obviously need it, but we don't want too much of it. And so what happens if we are constantly eating things that make our blood sugar spike, which could look like a bagel or a donut or a bunch of white rice or a bunch of bread, anything, or pasta, anything with a bunch of processed carbohydrates in it, not veggies, not high fiber, just like processed carbohydrates, that's going to cause your blood sugar to spike, which means it's going to go up. When this happens, your body sees this as a problem. Too much sugar in the blood, it releases insulin. So insulin gets released. The more insulin your body releases because of the higher blood sugar, the more it basically tells your body to store fat because it has enough energy, so you can kind of store away the sugar as fat. So when your body releases insulin, also stores fat, drops your blood sugar, this is where you feel this hangry feeling. So if you start your day with a bagel or a donut, let's say, you're going to eat it, you're going to have a surge of energy, blood sugar, and then straight down your blood sugar goes, and this is where you're feeling hungry, tired, lethargic, foggy. Foggy is a big piece of low blood sugar. And then you're looking for something else, another snack, something sugary, something full of energy to bring your blood sugar back up. This will continue all day long. You can't really escape this once this starts. It's really difficult to get out of the cycle. So, key takeaway here. Protein-centric breakfast. Savory breakfast. Not a lot of sugar at breakfast. That's going to bring your blood sugar, most people are around 80-ish in the morning if you're at a healthy blood sugar level. This is going to bring your blood sugar up and just let it chill for hours. That's why I push that egg casserole I make. It's not because it tastes amazing. It's good, but it does this for hours. And this causes so much productivity, so much mental clarity, so much great energy, so much of a better mood than this does, that that's why I do it. And that's why I push it, because that's the solution, is a big protein-centric breakfast. Obviously there are other choices out there besides eggs. We can talk about those if you work with me. Totally willing to explore other options. You do not have to eat eggs every morning, but it needs to be a hefty serving of protein in order to get your blood sugar up and stable for several hours so you can focus on your other stuff. So you're at work, you can do your work, you're not distracted by foggy brain and a lot of unproductivity because you're just so foggy and tired and lethargic. So then this is the key, is when lunchtime arrives, we'll just say noonish, we'll say 8ish, noonish, 6, whatever, normal like meal times for people, your blood sugar is still stable. It's not down here in the toilet where you absolutely have to find the quickest digesting thing to bring your blood sugar up. This is where you can make a good decision. Good protein, good fat, good fiber, low processed carbohydrates, more veggies. So protein, veggies, fiber, and fat are kind of the key to a balanced blood sugar level. So here you could have a salad or a colored green wrap or something with greens and protein and veggies and something that will satisfy you but also not weigh you down and make you feel like crap. So then your day goes on, and by dinner time, maybe you have a small snack in here, maybe not. Hopefully you don't need it. The point is that you don't need a snack all day long. And then here at dinner time, you can make a good decision. And then you shouldn't be looking for food after dinner because you should feel satisfied with all the food you ate all day long because it stabilizes your blood sugar. And so this is not, like, it's not gonna be a party in your mouth every time you eat. There's definitely room for that in the week. If you're eating at about 80% nutrient density, 80% of the time, that leaves you 2 or 3 meals a week to have like fun foods, which is totally fine and awesome. It's just like that 80% of the time, if your diet is really nutrient dense and you're really paying attention to balancing your blood sugar, you're gonna feel so much better. And you're gonna have a lot of energy. And you're gonna have a great mood, and you're gonna just be very stable. That's the problem is the ups and downs. It causes you to be exhausted, causes you to not make very good decisions. The fog is a thing. Like, this is a really big deal because type 2 diabetes is literally around the corner for a very large percentage of our population, and you don't want it. You don't want type 2 diabetes. It is not a pleasant thing to have. And it's a lot of medication and a lot of management and a lot of false information from doctors coming at you during that time because they're not looking out for your health. They won't even tell you if you're heading towards type 2 diabetes. They will tell you once you have it, and they will medicate you. And your options will be smaller then. It can be prevented, and it should be prevented. And I highly encourage you to educate yourself about how to prevent it because I promise you, you don't want it. So that's my little bit of a tough love for the day. I really am very, very passionate about this, if you can't tell. It's a very big deal. It's super important, and I'm happy to answer any questions you ever have about this. All my clients that I coach, we all work on, this is the very first thing we work on, is getting your blood sugar balanced so that you can actually take care of the other things you want to without these ups and downs that make you feel crazy. So that's it. Have a lovely afternoon, and I hope that you will please contact me if you have any questions. Have a good day.